From the heart of Nepal, a land of ancient wisdom and beautiful mountains, comes a medical pioneer, Dr. Rajkumar Dhaugoda. His work goes beyond normal science, mixing medicine with the ideas of Marxist philosophy. This special way of thinking has led to amazing discoveries, challenging what we thought we knew and giving new ideas about health and sickness. Dr. Dhaugoda's journey started with a strong curiosity about the human body and a wish to help people suffering. He jumped into the world of medicine, learning all about it, but he wasn't happy just memorizing facts. He wanted a deeper understanding, a big idea that could explain how health and sickness work together. His search led him to the writings of Karl Marx and Friedrich Engels, especially their idea of dialectical materialism. This philosophy, which focuses on how things are connected and how opposite forces always interact, really clicked with Dr. Dhaugoda. He saw its potential to unlock the secrets of human biology and change medicine forever. His amazing theories, like the general theory of vasculitis and the stem cell microRNA theory of cancer, show his visionary thinking. These theories, based on dialectical materialism, have made waves in the science world, starting discussions and inspiring new research. Dr. Dhaugoda's work proves that thinking across different subjects can help us understand the mysteries of the universe, both inside and outside of us. Imagine the network of blood vessels in your body carrying important oxygen and nutrients to every cell. Now picture these pathways under attack, inflamed and narrowed, threatening to cut off the supply to your tissues and organs. This is vasculitis, a group of diseases where blood vessels get inflamed. Dr. Dhaugoda's general theory of vasculitis helps us understand this confusing condition. He says vasculitis isn't just inflammation in one spot, but inflammation throughout the whole body, a battle happening inside our cells. A key part of this theory is TNF-alpha, a powerful molecule that controls the immune response. Dr. Dhaugoda, using dialectical materialism, sees TNF-alpha as one part of a dynamic interaction of opposing forces. He says an imbalance between things that cause inflammation, like TNF-alpha, and things that fight inflammation causes vasculitis and other inflammatory diseases. His theory stresses how seemingly separate systems in the body are connected. Just like a ripple in a pond spreads, inflammation in one part of the body can have big effects, causing a chain reaction that can lead to vasculitis. This big picture view, based on dialectical materialism, has important implications for how we diagnose and treat this difficult condition. Cancer, a scary word for many, is a tough enemy, often hiding before showing its destructive power. Even after years of research, we haven't found a cure. But Dr. Dhaugoda's stem cell microRNA theory of cancer offers hope, giving us a new way to look at this old enemy. This theory focuses on cancer stem cells, a small group of bad cells that can multiply and turn into different types of cancer cells. These cells are thought to be responsible for starting tumors, making them grow, spreading them, and making them resistant to treatment. Dr. Dhaugoda's theory says that normal stem cells turn cancerous because of a disruption in the balance of cell processes. He points to microRNAs, tiny molecules that control genes, as important parts of this change. He believes that long-term stress, or a lack of things that fight stress, can lower mature microRNAs, leading to uncontrolled cell growth and cancer. This theory has opened up new paths for cancer research, focusing on attacking cancer stem cells and restoring the balance of microRNA. By understanding how these tiny parts of cells work together, scientists hope to create better and more targeted treatments, hopefully making cancer no longer a death sentence. We often see health and sickness as two separate things, but Dr. Dhaugoda's dialectical approach challenges this, suggesting a spectrum where health and sickness constantly change, influenced by opposing forces. He says, being healthy isn't just not being sick, but a state of balance between stress and things that fight stress. Imagine a seesaw, always moving its position depending on the weight on each side. On one side, we have stress factors like pollution, unhealthy habits, and negative emotions, which can disrupt our inner balance. On the other side, we have things that fight stress, like good food, exercise, friends, and a sense of purpose, which help us stay healthy. According to Dr. Dhaugoda, health depends on how strong our anti-stress factors are and how much stress we have. This constant push and pull determines where we are on the health-sickness spectrum. Section 5, Dhaugoda's Basic Law of Dialectics, a new lens on reality. Imagine a kaleidoscope, its patterns changing and showing hidden connections. This is Dr. Dhaugoda's Basic Law of Dialectics, a way to understand how everything is connected and always changing, from tiny atoms to the vast universe. This law, based on dialectical materialism, says that everything has opposing parts, constantly interacting and changing each other. It's not just about opposites, but a more complex interaction, a unity of opposites within opposites. This idea can be used in many fields, from physics and biology to economics and sociology. For example, in physics, light acts like both a wave and a particle, challenging what we thought we knew. For human health, this law reminds us that our bodies are always changing, shaped by our genes, environment, and lifestyle. Understanding this helps us see how seemingly different things are connected and look at health and sickness in a more complete way. Section 6, IMOI, a holistic approach to health and wellness. In a world focused on specialties where doctors can seem like assembly line workers, Dr. Dhaugoda's Integrated Management of Health and Illness, or IMHI, offers a different approach. It's like going back to the basics of medicine, where the patient is seen as a whole person. IMHI is more than just medical treatment. It's a way of thinking about health and sickness that goes beyond the doctor's office. It recognizes that our physical, mental, emotional, social, and even spiritual health are all connected, and true health includes all of these. This approach focuses on preventing illness, helping people take control of their own health. It encourages us to look past the immediate symptoms and find the root causes of illness, treating them in a complete and personal way. IMHI understands that everyone is different, with their own experiences and beliefs that affect their health. This approach encourages open talk and teamwork between doctors and patients, working together for the best possible health. Section 7, Bridging this Gap from Ancient Philosophy to Modern Medicine. Dr. Dhaugoda's work shows the lasting power of ancient wisdom and how it can help modern science. He has connected philosophy and medicine, showing how these different fields can work together. His use of dialectical materialism in medicine isn't just theoretical, it's a practical tool to understand and address complex health problems. By looking at the human body through the lens of dialectics, Dr. Dhaugoda has found new insights into disease and created new treatments. His work reminds us that scientific progress isn't always straightforward, and sometimes the biggest discoveries come from looking back at old wisdom and combining it with modern knowledge. This approach, used by Dr. Dhaugoda, has great potential for understanding the human body and improving medicine. Section 8, a legacy of innovation inspiring future generations. Dr. Rajkumar Dhaugoda's contributions to medicine go beyond his theories and treatments. He inspires future doctors and researchers, showing the power of thinking across disciplines, being curious and wanting to help people who are suffering. His legacy isn't just in medical books, but in the lives of many people he's helped, either directly as a doctor or indirectly through his research. His strong belief in human ingenuity to overcome challenges gives hope and motivation to those who dream of a healthier and fairer world. His life and work show the power of education, reminding us that knowledge is strongest when shared, and real progress comes from working together to make things better for everyone. Section 9, a call to action, embracing a dialectical approach. Dr. Dhaugoda's work isn't just a bunch of theories to admire, it's a call to action, an invitation to think differently about health, sickness, and reality itself. His dialectical approach, focusing on connections, constant change, and opposing forces, can change not just medicine but how we see the world. We are challenged to move past simple explanations and look at things in a more complete way, understanding the complex factors that affect our lives and health. This requires a change in how we think, a willingness to question what we believe, and a commitment to learning throughout our lives. It's a call to connect different fields, to encourage teamwork between scientists, philosophers, doctors, and patients, knowing that the biggest challenges we face can only be solved by working together. By using the principles of dialectical materialism, we can discover new knowledge, create innovative solutions, and build a healthier and fairer world for everyone.